Okay, today we're going to talk about public health and how that works in our area to create everything we're doing for education to the public. This is also something for those of you, once you're done with your EMS career, want to get administration, something that you guys may be able to get into and would be fantastic in with your experience. So, big thing that we're looking to is we have a commitment as EMS providers to jump in, and we want to help because of what we can do on scene. We get on the crisis, we're able to see the effort that we're giving out to patients, and we're seeing how we're able to improve efforts. Not usually what brings us back and draws us in to keep doing this on a daily basis. How public health helps is a different area. So they're looking for the general public's entire health. They're using from preventative medicine. They're doing health education programs that we're going to be a part of, transmission of diseases, infection control, sanitary errors, MCIs, a huge list of things that go on the outside and brings us together. Some of those changes are going to be bringing in the physicians, the nurses, and administrative people through the mayor, different county commissioners coming in and making those decisions of what needs to be done for the public and the best thing for the communities. And we get that strong relationship, and we rely on EMS people to do that together to do planning. And that's bringing all these people in. So that's everything from our disaster plans, which we have out in place for when we have MCIs and where we transport people to. We're doing constant drills, and as we do these drills, there's got to be funding for this. And this is where the community comes and supports us to come up with those fundings. And how this comes out is just how we do in general life and practice here. So we do an assessment. We find out what's going on, and they do that area here. Then they come up with policies to try and better improve and take care of those areas we're finding as issues. Then we'll go back and we'll do a quality assurance and keep going back to make sure that everything is working out. And what are we getting for results? Then we'll come back and we'll reassess. Have we made any changes? Do we need to move from there? Those things come into these places here of vaccinations, doing motor safety, doing safer workplace areas, and doing studies, controlling of infection disease and vaccinations. So all these are going to be a huge portion of what's going to be going on out there. It's going out from the foods, and we talk about what people should be eating. It's doing these well baby visits coming out, family planning areas, everything they do, fluoride in the water, and then the anti-smoking and everything else that we're having out there and educating the public on. So all are going to be huge factors out here of what we do. Illness and prevention is a big public safety thing, making sure we have the police agencies and other powers out there to enforce these areas. And then when we work with big administration like world factors like WHO and that. They do AIDS research, they do cancer research, they do everything out there for public epidemics and to improve everything for our community. We've decreased the amount of diseases in these large populations because of areas like this, and we're able to continue doing studies and find out what's going out. The big thing right now is the Zika virus and doing sprays from there. This is all a public health area, and we do play a big part in this. One of the big things they look at here is how can we increase life? So 65 being the average lifespan. What can we do to increase life beyond that time? Doing risk prevention, fall prevention, all sorts of aspects, as you can kind of see, of going on, of continually looking at what we can do to increase our lifespan and our roles. So public health goes out and does surveillance. There's field investigations. They look over studies. They read our reports. There's a whole different things that they come up to find out exactly what the problems are, and then come up with policies, procedures, and things to implement. And that's where we get a lot of our changes. Basically, what it's going to be in our role in there. Well, we're going to be there for health promotion. We're going to be involved in that disaster management, and we're going to be the front line on injury prevention, finding out where they are and what we can do to make changes for that. When we see falls, when we see people coming out and be constantly being transported, so we're going to go out there and we're going to be an advocate for those patients and document those. That's when we bring in the Spokane Cares team. We talk about compression only CPR and putting classes on. We talk about everything that we're doing to promote and push out training to the citizens of what we're going to do. Our whole care is basically not only protecting them, but protection of ourselves. What can we do to protect us with Pulse Point to bring people out? We're going to talk about what's the protection we can do for our providers, all the things that we're going to do to make changes. The other thing is reaching out into the public to basically do different programs and be aware of different things they can do to be safer and help reduce what we have to do. As this one shows, prevention for drowning. There's lots of different things we're doing all the time to help with the public. We're doing our commitment to basically stay fit, the new firefighter fitness programs that are out there. Doing stress management, we're going to really work on people after incidences for debriefing. And we're doing our EVIP, EVAP, however you want to talk about the classes now. We'll talk about hand washing, sanitation, different things we can be prevented. The new WAC laws that basically require us to wear glasses on scene all the time. A lot of different things are basically being retroactive changes to help with the safety of our EMS providers. Always be looking out for your safety and your partner safety first. Doing our equipment checks. Not approaching scene. A lot of times we have stand back for law for our calls to make sure the scene is safe. We're going to talk about best practices. I know City Fire and a lot of other agents are doing this right now where we're taking turnouts and putting it in special gear so it's not in the compartments with you after the fire to help prevent cancer and other issues. We're doing hood exchange programs. All these things are coming out from public awareness. Making sure we have our commitment to scene safety, and that is basically blocking down the roads, wearing your protective reflective gear so you can be seen better, making sure everyone's buckled in the crews. And I know we are not transporting dead patients, as we say now, in the ambulances just to prevent there. And then we're getting to see where we can be more active, taking care of the kids, doing the bike prevention programs, checking out car seats, all those type of things, because half of the deaths that we get out there, besides dealing with alcohol, we're going to be dealing with texting, other type of issues that we go out to, but they're injuries that can be definitely prevented. We talk about the geriatric patients. That's a high volume of calls I know I go on, is for people that are falling and using the care teams, using some areas to do fall prevention classes, basically to prevent us from going out and to helping those people from potential other injuries. Other aspect we're going to do is in the work prevention area. So lifting techniques, and we're going to talk about lifting. We're talking about handling people. We talked about injuries to the eyes and hands, so it's wearing the proper gloves, wearing glasses on scene, and it's staying fit and active and stretching so you don't have those. Where else can we be? Well, we're making sure with this community paramedicine and making sure people are taking their medicine properly and on time. If we get someone early discharge, can we do a follow-up so that they're not coming back and being readmitted to the hospitals? Doing safety programs, recognizing hazards when we go in up there, documenting these and reporting them. All these things are going to be really important, and we'll talk about our documentation because those are what's going to make the changes and make our life easier as EMS providers down the road. But more, what we're looking for is those injury preventions and things that makes the society better. We're going to be promoting vaccinations, well baby visits, more elder care clinics, and you'll see those kind of coming up. And then especially getting the elderly patients in driving classes to continue so that there's not hazards there. Big thing that we'll be doing too, or not will be doing, but the prevention areas is going out and doing work class safeties, health clinics. All this stuff is going to be a huge priority for us in making our lives easier. And we have to make that shared effort to go out there, document those things, report those things, and make this a better society.